Hi, I'm Nathan Young, board certified sports physical therapist with Yada Yada. Today I'm going to talk about my 5 most common shoulder strengthening exercises. These are the exercises for those of you that have a moderate irritable shoulder, or most of the time you have shoulder pain. It's limiting you when you lift up your arm overhead. You have pain in the front of your shoulder, but you're able to perform your activities. You have some pain, but you're able to complete those exercises. If your pain is more severe than that, then you should go and look at my video on beginning shoulder exercises or a highly irritable shoulder right here. If these exercises are too easy and you want advanced exercise for those of you returning to sports or heavy lifting or work activities, you want to see my video on advanced shoulder strengthening exercise. So a lot of us, with the activities we do, we don't strengthen our rotator cuff and we get pain and weakness, which causes your shoulder to rise up in the socket and pinch and cause shoulder impingement or subacromial pain. And these exercises are my 5 most common that I use with Theraband to strengthen your shoulder. My first exercise is shoulder external rotation. I want you to use a towel. When they've done research, you fire more of the shoulder external rotator muscles when using a towel. So you can place the towel under your arm. That lets us not cheat and straighten your arm or go out to the side, so we're firing the correct muscle. So with a Theraband here, good posture, and you're going to bring your arm straight out to the side, hold 1, 2, and then come back in, and a nice slow steady motion, holding for a second or 2 and then coming back in. When performing this exercise, you want to do 3 sets of 10, holding for a couple seconds daily. One of the nice things with the Theraband, if it's easy, you can step a little farther out and give more resistance. If it's too hard, step a little closer until you can get where you're able to perform those 3 sets of 10. My second exercise is shoulder internal rotation, or bringing it across your body. We're going to still use our towel. We're going to put it underneath your arm like this and keep a good upright posture. Bringing it across your body, holding 1, 2, and then coming back. Coming across your body and holding it. So we want to do the same there, 3 sets of 10, holding for a couple seconds daily. My third exercise that I'm going to show you today is a roll or shoulder retraction. So with a good upright posture, I want to pull back. I want to squeeze my shoulder blades together for a couple seconds and then back. Go ahead and pull, holding for a few seconds and then coming back. Remember to keep that good upright posture. My fourth exercise is shoulder extension. So here we're going to have your arms straight and down by your side. You're going to pull back and then squeeze your shoulder blades together, holding for a couple seconds. Remember to keep good upright posture. Again, pull back, hold 1, 2, keep a good upright posture, and then bring it back. Those third and fourth exercises are strengthening your shoulder blade muscles. The reason why we're trying to get those stronger is to kind of control our shoulder blade so it comes up in a good posture and not rotating forward. The last exercise I want to do, you can get a band and tie it together, or a loop band around your hands. I call this the Serratus Anterior exercise, which is a strengthening of a shoulder blade or scapular stabilizer. So in this position, you're going to hold it, you're going to push out and then bring it up till you feel it and then bring it back down. I'll show you from the side a good posture. You're pushing out, which actually gets some of our shoulder external rotators, and then bringing it up and then letting it down. Again, pushing out, holding for a few seconds at the top, and then bringing it down. With that exercise, I like to make sure each time you push out to engage the rotator cuff muscles and then lift your arms up to strengthen your shoulder. These are the 5 most common exercises that I use in the clinic for patients with shoulder pain, strengthening the rotator cuff and the scapular stabilizers. Remember to do these exercises 3 sets of 10, holding for a couple seconds daily. If the exercise is too easy, you can step farther away from the Theraband. If it's too hard, you can step closer. And make sure you're performing these exercises for 3 to 4 weeks to see a change. And hopefully your shoulder will start to feel better. Like always, if it's not getting better or your symptoms are getting worse, follow up with your local healthcare provider. Thank you.